When was the last time you really looked at your eyes? Not to check if they're tired, not to see if they're red, but to actually examine them the way a doctor would. Because your eyes are not just for seeing. They are one of the only places in your entire body where a doctor can look directly at your blood vessels, your nerves, and your organ function without making a single incision. The whites of your eyes, the color of your iris, the skin around your lids, the tiny vessels in your cornea, each one is a direct window into what is happening in your liver, your thyroid, your heart, your cholesterol levels, and your brain. This is episode 4 of the Body Warning Signs series. We have covered your tongue, your ankles, and your nails. Today, your eyes. And I promise you, at least one thing in this episode is going to make you want to look in a mirror the moment the video ends. Before we begin, nothing in this video is medical advice. This is educational content based on published research. Always consult your healthcare provider before acting on anything you see here. To understand why the eyes are such a powerful diagnostic tool, you need to understand what makes them unique among all the organs in your body. Your eye is the only organ where blood vessels can be seen directly and non-invasively from the outside. The retinal blood vessels, visible through the pupil to any doctor with an ophthalmoscope, are a direct reflection of the health of every blood vessel in your body. If your retinal vessels show hardening, narrowing, or leaking, the same changes are almost certainly happening in your heart, your kidneys, and your brain. Beyond the retina, the whites of your eyes, the sclera, are covered by a thin, transparent membrane called the conjunctiva, which is fed directly by your systemic circulation. Changes in your blood chemistry show up here very quickly, sometimes within hours of a significant internal change. And the skin around the eyes, the eyelids, the under eye area, the corners, is some of the thinnest skin on the human body. Fat deposits, fluid retention, and pigment changes that would be invisible elsewhere show up clearly here first. Sign 1. Yellow whites of the eyes, jaundice. If the whites of your eyes have a yellow tinge, not bloodshot red, but yellow, this is called scleral icterus, and it is one of the most important signs in all of medicine. It means bilirubin, a yellow pigment produced when red blood cells break down, is building up in your bloodstream instead of being processed and excreted by your liver. Yellow whites almost always indicate liver stress, hepatitis, cirrhosis, bile duct obstruction, or in some cases a rapid breakdown of red blood cells called hemolysis. This is not a sign to monitor. If you notice yellowing of the whites of your eyes, call your doctor today, same day. Liver problems caught early are very treatable. Caught late, they are not. Sign 2. Yellow fatty deposits on the eyelids, xanthelasma. Xanthelasma are soft, yellowish, slightly raised deposits that appear on or around the eyelids, usually in the inner corners near the nose. They are flat or slightly raised, pale yellow in color, and feel soft to the touch. These deposits are made of cholesterol-filled immune cells called macrophages, essentially your body's attempt to clean up excess lipids that have accumulated in the skin. A landmark study published in the British Medical Journal followed over 12,000 people for 33 years and found that xanthelasma were associated with a 48% increased risk of heart attack and a 39% increased risk of heart disease, independent of measured cholesterol levels.
Sign 3. Persistent redness in the whites. Occasional red eyes from tiredness or irritation are normal, but persistent redness, particularly when it affects only one eye, when it doesn't respond to rest or eye drops, or when it is accompanied by pain or vision changes, tells a different story. In seniors, chronic red eyes that don't resolve are frequently linked to dry eye syndrome caused by autoimmune conditions like Sjogren's syndrome, very common in women over 60, or to elevated blood pressure causing small vessel dilation in the conjunctiva. Persistent unilateral redness with any vision change is an emergency. It can indicate acute angle closure glaucoma, which causes permanent vision loss within hours if untreated. Sign 4. Puffy upper eyelids in the morning. Almost everyone gets slightly puffy eyes after sleeping, but if your upper eyelids are consistently swollen or heavy in the morning, not just occasionally, but most mornings, and the puffiness takes more than an hour to resolve, This pattern points strongly toward thyroid dysfunction, specifically hypothyroidism. The thyroid controls your body's metabolism and fluid regulation. When it underperforms, fluid accumulates in the soft tissues, and the loose skin around the eyes is one of the first places this shows up. Other hypothyroid signs that often accompany puffy eyelids include persistent fatigue, cold sensitivity, constipation, and unexplained weight gain.
We are almost at the end of the body warning series, and I hope by now you are looking at your body completely differently. Your tongue, your ankles, your nails, your eyes, all of them have been communicating with you your whole life. Now you speak the language. Next week is the final episode, episode 5. We are looking at your skin, because skin color changes after 60. Yellowing, graying, sudden redness, unusual darkening in specific places map directly to your liver, your kidneys, your adrenal glands, and your blood. And some of what I'll show you next week are signs that most people have had for years without ever knowing what they meant. Subscribe and hit the bell right now so you don't miss the finale. And if this series has helped you, share it with someone you love who is over 60. You have now given them a diagnostic toolkit that most people never receive in their entire lives.